It is really important to recognize that a women's heart is different from a man's heart.
On a Friday night, had taken some medicine, and suddenly I said, this is weird, this kind of hurts. And I don't want to be a hypochondriac, but it went from hurting to that, I guess I've heard it described before, that classic crushing chest pain. I could not. I called 911 and collapsed.
50 years ago, we thought that this is a man's disease, and actually they used to have in magazines and conferences for women how to prevent heart disease in your man. So we've come a long way since then, and like I said, we really have to start, as women, we really have to start taking care of ourselves.
Statistics have shown that women are not aware that heart disease is the leading cause of death for them. We here at Emory have a multidisciplinary team, and we practice prevention and treatment of heart disease from a team-based approach.
At Emory, we have different diagnostic tools that we may use to diagnose women with heart disease. So even if a woman has a normal cardiac cath, which means that it's clean, there are no plaque buildup, we can use different techniques to find out if they have different kind of disease.
Emory has really been in the forefront of cardiology, and it makes sense that they would also be in the forefront of this new initiative towards focusing on what's different about women and women's heart health.
The women who are coming to our Emory Women's Heart Center are very thrilled at the kind of care we're providing. They're finally excited to hire someone who takes the time to listen to all their complaints and can go through the appropriate testing and treatment for their particular symptoms.
Women may have atypical symptoms. They are maybe shortness of breath for a prolonged period of time. They may be fatigued. And as women, we think that maybe we're just overexerting ourselves or stressed out, and we don't really seek care.
I've known some incredibly wonderful male physicians, but to say to a woman, I want to see my children grow up, there's just a different understanding of what that means.
I can connect to that. I have 2 children, and I know how important it is for them. So that makes me just work extra hard to take care of them.
It's a great atmosphere. I mean, we're all enthusiastic because finally we're able to provide women with the kind of care that they need. It helps that majority of the team is actually women, so we have a vested interest in treating our female patients.
I just love doing what I do.